Good morning. Today I want to talk a little bit about the debate about whether you're in recovery if you're taking Suboxone medication. You know, when Methadone first came out in the, I think, 60s, there was a lot of people who thought, oh, if you're on Methadone, you're not in recovery, you're just switching one addictive drug to another. And of course, the same debate happens with Suboxone. But as time goes on, we've realized that Suboxone and Methadone can be incredibly useful tools to help people on a bridge to recovery without any medication. And that these medicines can be really helpful, and people really can be in recovery on these medicines. The key to the differential is the dopamine spike. You know, when people use addictive drugs, alcohol, cocaine, heroin, any of the addictive drugs, they all spike dopamine in the reward system in the brain. And that's what our brain reacts to and really likes, and then that sends messages to the frontal lobes that we value that and we want to keep doing it, and it sort of creates this whole sort of cascade of people thinking, changing to value that thing and to keep doing it. And so what Suboxone and Methadone can do is when you're on a maintenance level, a maintenance dose, and you're not getting the dopamine spike, you're just getting the medication that does. They are addictive drugs, no question, but they go to the to the endorphin receptors and occupy those receptors, but they don't release a dopamine spike in the same way that the addictive drugs do. And so then the brain can settle down and start thinking more clearly and having more clear emotions. So the key to this is the definition of what is recovery. And so my recommendation is that people on maintenance Suboxone or Methadone claim a recovery date, and they consider themselves in recovery. And the way I think about it is there are really three things that make people in recovery who are on maintenance medicine. The first one is taking the medicine as prescribed. So, you need to work with your provider, your physician or nurse practitioner, to get a good dose that has no side effects and is stable, and take that as directed. If you need more, then ask for more. If you need less, then take less. But that's a relationship between you and your doctor, just as if you're on an antidepressant. The second is to not use any other addictive drugs. So no alcohol, no pot, no cocaine, no amphetamines on the weekends, just medicines as prescribed by your physician. And that way you're no different than people who are not on Suboxone or Methadone. They're abstinent, they're not using any other addictive drugs. And the third piece is working some kind of emotional or spiritual recovery program. And what we mean by that is that you're growing as a person, that you're getting better in all the other aspects of your life. You're learning how to deal with stress, you're learning how to develop new friendships, you're paying attention to what's going on in your life. You're becoming better as a person in all aspects, in your relationships, your work, your finances, your hobbies, all of that sort of stuff. And if you're doing those three things, then I consider you in recovery, and I think you should consider yourself in recovery. And I think you should claim a recovery date. So when I'm working with patients who are on Suboxone, I'm asking them that question. What's your recovery date? Because I think when you claim that date, then you put a marker in the ground and you say, this is it. I'm in recovery. I'm taking my medicine as prescribed. I'm not using other addictive drugs, and I'm working on my program. And as I do that, I'm continuing to grow. And some of those people won't need their maintenance Suboxone or Methadone at some point, and some will need it for quite a while. It doesn't matter. You're in recovery.